And a local expert is urging men to do more to protect themselves from COVID-19 amidst fears of long-term erectile dysfunction in COVID-19 survivors. Speaking on TVJ's All Angles on Wednesday, Professor of Public Health and Epidemiology at the UWI, Peter Figueroa, said it goes beyond just taking the vaccine. Kalisha Williams reports.
So I'm 25 and I had a near-death experience. I wrote a will. I'm not able to function as with erectile dysfunction now. Those are actually scary things.
COVID-19 survivor Craig Powell sharing his experience with COVID-19 on TVJ's All Angles on Wednesday. Mr. Powell's story had been making rounds on social media over the past days, with people questioning whether COVID-19 can actually cause erectile dysfunction. We put that question to Professor of Public Health and Epidemiology at the UWI, Peter Figueroa, who was also speaking on the show.
There have been reports of erectile dysfunction being a side effect, a complication of persons who have COVID, particularly if they have severe COVID. So I really have to commend and thank Craig for being willing to speak about it.
Reports like this one by American online medical news outlet WebMD. It says COVID-19 increases the risk of developing erectile dysfunction ED by nearly 6 times, according to data from the first study to investigate the association between ED and COVID-19 in young men in a real-life setting. And it also said men who already had erectile dysfunction are 5 times more likely to contract COVID-19. Craig Powell had indicated that his story had convinced many people to take the vaccine in order to lower the possible effects of erectile dysfunction. But Professor Figueroa said it goes beyond that.
The only thing I would add to what he said is that not only do people need to get vaccinated, but because we're waiting on more vaccine and it's going to take some time to get everyone vaccinated, the message that he's also sending to us is that we have to protect ourselves from getting COVID.
The World Health Organization had made it clear that getting the COVID-19 vaccine does not stop someone from contracting the virus. Kalisha Williams, TVJ News.